Wonderful. Yeah, thanks so much for joining, everyone. I'm really excited about the next hour. Yeah, we're gonna do some introductions. I'm gonna hand over to Grassroot Soccer's mental health specialist, Charmaine, after that to take you through a presentation, and then we're trying to save lots of time for Q&A. We know this group has a lot of expertise, and we're really privileged to have you join us and share some of your ideas, ask questions. So if that's okay, I'm going to be kind of rude, just for the sake of time. I'm going to be rude to some of my Grassroot Soccer colleagues and just ask that Charmaine and Tommy introduce themselves. We have a group listening in from Grassroot Soccer. But for the sake of time, I'll just ask Tommy and Charmaine to introduce themselves. But then all of our guests, we would really love to hear from our guests, which group, organization you're coming from. And if you don't mind, just to help us start the conversation, we would love to know, we love you to tell us, the organization you work for, what you do there, and what is something you're most excited about in your mental health work. We'd love to hear a few sentences about what's really getting you animated when it comes to mental health work. So, but maybe we can start with, I'll go and then I'll hand it over to my Grassroot Soccer colleagues, and then guests, we'd love to hear from you. Yeah, video is optional. Some people stay off just for connectivity. I hate saying this because it sounds sort of Big Brother, but you are being recorded. That's just so we can share it internally with some colleagues that couldn't join. So yeah, once again, welcome. My name's Chris Barkley. I'm based in Cape Town, South Africa. I'm Grassroot Soccer's mental health advisor, and I have been working with Grassroot Soccer for almost 20 years now, and really happy to be working in mental health now.
I can jump in. Chris, will you call on people just so we can go through quickly? That might be good, but I can jump in and then I'll turn it over. So yeah, I'm Tommy Clark. I'm the CEO, co-founder of GRS. I guess just real quick on mental health. I had one of my kids, a year and a half ago had some issues, and we had sort of access to some of the leading sort of psychiatrists and some of my friends and top people in this area. And when the thing that made a difference was when my kid's friend shared that they had also had the same issue, and that made all the difference. Like, all of a sudden it was like, that's, all these, no offense to all the experts on the call, but just the importance of a peer. So obviously this is a little bit pro GRS, but that was sort of that kind of brought it home for me. Charmaine.
Hi, everyone. I'm Charmaine Yakonda. I'm based in Bulawayo, Zimbabwe, and I work as the Grassroots Soccer mental health specialist with a background in pediatrics neuroimaging. So what I'm very excited about in mental health is exploring non-clinical approaches and promotion and prevention approaches to mental health, given just how much data we're getting about how adolescence is this perfect window to intervene. So for me, that's what I'm really excited about, coming from a heavily science background.
Thanks, Tommy. Thanks, Charmaine. If it's okay with the group, I'm just gonna, how you're showing up, your little bobbing head on my screen, I'm just gonna call from left to right. So is that okay? Mike, would you mind saying hello and introducing yourself?
Sure. Good morning, good afternoon, everyone. I'm Mike McCabe. I'm the regional director for the Inter-American Pacific region of Peace Corps. I've been engaged in looking at issues of adolescent mental health a lot in my previous job as global youth coordinator at USAID, where we put out basically a strategy workbook on how our posts were working on adolescent mental health issues, as well as supported young leaders who are working in that space. So.
Brilliant. Mike, anything that's getting you really animated about work in mental health right now?
Yeah, I mean, I think to see the Surgeon General out there speaking about, the epidemic of it, both in the U.S. and then globally, is really important. We've been looking at it, how it affects not only our volunteers, but the young people in the communities where we work, and we just see it as a great opportunity to talk about kind of, healthy mind, healthy body as as a pathway for how our volunteers could work effectively with young leaders and communities. So.
I love it. Thanks, Mike. The next on my screen is Katie Green.
Hi there. Yep, my name's Katie Green. I work with Mike I'm the Chief of Programming and Training in the Inter-American Pacific region at Peace Corps right now. Previously worked with Grassroot Soccer as a DPT in Rwanda. So that's, and had some meetings a long time ago, I think, with Tommy and in the Peace Corps hallways. I was a youth development specialist at Peace Corps. I have like a 25-year career in positive youth development, but I started at working with young people in psychiatric settings. So I feel like there's a little bit of a full circle going from dealing with young people with mental health challenges. And I feel like this is the next kind of frontier of the positive youth development field as well. And also being the parent of 2 teenage girls has, as Tommy pointed out, it's nothing like it when it comes knocking at your door. So that's what I'm excited about.
Thanks, Katie. Joshua?
Good morning and good afternoon. My name is Joshua O'Donnell, and I work with Katie and Mike in the Inter-American Pacific region at Peace Corps. I'm the Regional Security Advisor. And yesterday was the end of coaching this season for youth soccer here in Tacoma Park, Maryland. And afterwards, I was reflecting on it and said, I just need to kind of clue into grassroots soccer more. And so Katie invited me, and here I am. So thanks for having me.
Welcome, Joshua. Cynthia? And I see there's someone with you there too, Cynthia.
Yeah, this is Alan, my husband.
Hey, Tommy.
Do you want to start?
No, go ahead.
Okay. I'm Cynthia King Guffey. This is Alan Guffey. We've been long-term enthusiasts of grassroots soccer and financial supporters. Alan's a high school teacher, so mental health is near and dear to his heart. And I've been working on this strength-based app that's focused on helping people become their best selves and strengthening relationships. So I think the thing that animates me is you know, the positive youth movement of positive youth development, a strength-based approach, taking a strength-based approach to mental health. And I think the thing that I get excited about is as some of you've mentioned, the you know, talking about it, just the fact that we're talking about it, and that's empowering, and like Tommy, what you said, just like people sharing, oh, me too, you know. I'm not weird. We all have mental health ups and downs, and so that's exciting to me.
Thanks, Cynthia. Katie Weeks. Yeah.
Hey everyone. My name is Katie Weeks. I also work at Peace Corps. I work though in the Office of Global Health and HIV. So I'm the Peace Corps POC for GRS as well. I'm an HIV program specialist. And I think the reason why I'm here is obviously to learn more about mind skills and the mental health work that you all are doing. It's, you know, our volunteers are in the field right now, living and working with community members, with youth, you know, being positioned in safe spaces to have very, you know, sensitive conversations. And so thinking about how they can be supportive of, you know, the youth of people that they live with. Around mental health is what motivates me. You know, they are working in very close quarters. So what's sort of the positive role that they can play within their communities around mental health is what motivates me to be here. So thanks for inviting us.
Brilliant. All right, John, I'm not sure you could hear me. Maybe we'll go on to Marcia, or maybe you're frozen.
You might have been frozen, Chris. Couldn't hear you.
Oh, it was me. Sorry.
So were you calling on me? Yes, you were stuck with a very smiling face for a bit there. Yeah, I'm John. I am the CEO of the VTOL Foundation. We've been long-standing supporters of grassroots soccer for a number of years, and over the last few years, we've also started to develop quite a lot of mental health work internationally in our under our health program, and so it's kind of a core subject for us. And to echo what Tommy and Katie were saying about how when it hits when it's these sort of things appear in your own family, I'd have to say that I can totally relate to that. And particularly, I have my third. We have 4 children. Our third son was quite severely affected in his, I guess, late teens, and actually now works for a small mental health, well, actually it's nationwide, but it just in the UK, adolescent mental health organization called Young Minds. And what's struck me throughout is how sharing is extremely difficult, but invariably positive. It's a very hard hurdle to climb over if you're the one suffering, but once you've done it, you have created a huge amount of space and support for everybody in your networks. And I've got direct experience of how that worked in the case of my son. As far as what is exciting us, I think it's also something at the same time kind of is a concern. As I say, we do a lot of work in all parts of the world. We're just starting some work in Pakistan, a kind of a sensitization awareness program, and you realize that you're battling against extreme odds to get messages out, and there's also a gap between. It's great for people to talk about things, but it's not always so easy once they've done that to signpost them to relevant support, or indeed for that support to be available. I mean, this stat, which so many of you will already know, is that in most of the areas we work, 1 mental health professional per million people is a good kind of benchmark. And that, when you think about it, compared to what we might be used to in our home countries, is quite a terrifying statistic. But delighted to be part of the group today.
Thanks so much, John, for sharing personal experiences and also highlighting, I think a big challenge that we're all sort of grappling with. So thanks so much. Next on my screen is Marcia.
Hey, thanks, Chris. Hi, my name's Marcia Brophy. I'm here for UNICEF on behalf of Zainab. I'm part of Zainab Hizaji's global mental health team, but I'm based in London, not in New York though. We are here to listen and learn. We've been trying to think up some ways of how we could maybe collaborate with Grassroots, I know, for a good few months yet. So I'm here just to really listen and kind of excited to learn more about the great work that you're doing. And I guess the extra excitement on top of that excitement already would be around innovation. My particular portfolio globally is looking at innovation in mental health services and practices. So not just digital, but non-digital. Very importantly, there's a lot of innovation being undertaken in that area. Really excited about ensuring youth co-creation throughout, from project ideas right through to service delivery, and ensuring evidence informs all of our practice. So yeah, thanks for the invite. I'm really looking forward to hear.
Excellent. And the last person I have on my screen is Rebecca.
Good morning, good afternoon, everyone. I'm Rebecca Luria Phillips, Program Training Specialist with Peace Corps in the Inter-American Pacific region. And I guess the prompt is, what one thing that excites us about youth mental health. Is that okay? Yeah, I guess it's a little bit of a new area for me. I'm a mother to 2 teenagers. So that's where I feel like I have my practitioner experience, and I appreciate how much that's challenged me in good ways to think outside the box. And that young people today, at least in the US context, have a lot of like fluency and literacy with mental health. And it's significantly destigmatized from when I was their age and stuff. So I feel like it's a promising area to move into. And, you know, just in my parenting experience, sort of recognizing I don't know, you know, things that like I just accepted, so to speak. And, you know, now as I kind of see this reflected through my kids, I'm like, okay, like, well, that could have gone different if I had been aware of things. And so, you know, just kind of feeling that hope, and, you know, looking at this through the international lens.
I love that. Thanks, Rebecca. Okay, brilliant. I'm going to say a couple more things just on the context, and then I'm going to hand over to Charmaine. And I have to say, it's a little bit, it's kind of trippy to have this group for me because earlier this year, I was trying to go through like my top like 5 most influential papers, kind of shaping my thinking in mental health. And one was some of the youth power stuff, Mike, especially the soft skills review you did. I still think, you know, even though it's 2016, I find that so helpful. And then from UNICEF, the Helping Adolescents Thrive toolkit has been so informative. And there's, I don't know how much fanfare it got, but there's this amazing companion report to UNICEF's State of the World's Children 2021. It's this whole qualitative report from, I think, 75 focus groups from 50 countries or something. And it's really all about like the language and the way that young people express and experience mental health in these kind of non-clinical everyday ways. And I found it so powerful. Anyways, it's really great to have that group here. And then I think from Vitol, it's, you know, Vitol is enabling us to ask these questions about how do you integrate mental health into work that we're already doing in sexual reproductive health and HIV and gender. And that's such a huge question. You know, we don't want to replace all this amazing work that's happening in communities. And it's a big question about how do you integrate? What does it mean to integrate? What are some good practices? What does that look like on the ground? And so it's just great to have this group here. And I'm just feeling like really humbled that everyone's here. So we developed a mental health strategy, I guess almost 2 years ago. Time is flying. And we've sort of had our head down, just kind of implementing. And this learning series is us trying to, this is maybe the 3rd call. It's us trying to come up for air a little bit and just kind of check ourselves. We want to present what we've been doing to as many stakeholders as possible that have sort of a vested interest in our work, that have interesting perspectives on mental health. And we really want to hear your thoughts. We want to share what we've been up to, but then kind of hear, you know, your critiques, your questions, things that get you excited about the work we're doing as a process of continuing to learn and grow as an organization. So thanks again for your time. I'm going to hand over to Charmaine unless any of my GRS colleagues want to help set the stage different or add anything. Yeah. Okay, great. I'm going to share my screen, Charmaine, and then I'm going to go on mute.
Thank you, Chris. Welcome again, everyone. I will take you through our presentation, but I will be stopping at some points to ask for questions from the group and any additions or thoughts that the group may have. Next slide, please, Chris. So firstly, setting kind of the context of what the problem looks like, where globally, poor mental health is the #1 cause of disability among young people. And that's kind of the first layer of the problem, where at least 25% of adolescents experience depression, where there's even higher rates in sub-Saharan Africa. And then the second aspect of the problem then being that 75% disorders onset by 24. And we also know that 50% of mental health disorders onset by 14. So you have this 14 to 24-year-old age range, which is representing this most important window of opportunity to reduce the burdens and consequences of mental disorders by equipping young people with the skills and knowledge on how to cope with stress and everyday challenges. And then the last key aspect which came out in a lot of the comments people gave in the beginning is this idea that there is less than one psychiatrist per 1 million people in countries where there is this huge burden. And over 90% of adolescents in sub-Saharan Africa never receive the healthcare that they need. So you have this three-layered problem that keeps suggesting this idea that adolescence is the right window, the right window and the most important window of opportunity to reduce these burdens, but also something along the lines of adolescent mental health promotion and prevention may be key in thinking about how some of the multiple layers of the problem also include lack of access to specialized healthcare services. Next slide. And the impact of this problem we've seen as we have been working for over 20 years in HIV programming, in SRHR, where you see that the impact of poor mental health is not just on mental health issues and mental health challenges, but it also has this impact on these other areas we work in, like the higher risk in acquiring HIV, the higher risks of teenage pregnancy, the really high rates of suicide among people with depression, and then, you know, this trickle-down effect where the impact is not only just at an individual health level, but at an economic health level, where you're seeing the 6 trillion cost to global economies of the impact of this particular problem. Next slide, please. So our mental health solution really came from thinking about filling in this critical care gap in mental health by training non-specialized people to work with young people and improve their mental health awareness and resiliency, where we were thinking about helping young people to develop the skills to manage their thoughts and feelings, emotions, and behaviors so that they can have this healthy mind, and then also equipping these participants with the right type of knowledge and tools and coping skills to be able to have and maintain a healthy body that fuels this healthy mind. And then also as a last layer of thinking about our approach, that's more a non-clinical and holistic approach, where the last aspect was then thinking about equipping these young people with enough knowledge and access to working with and building their communities to build these support networks that they need for themselves and others. And one key thing that's really come out in thinking about our mental health solution and where it's currently being implemented and speaking to young people is this value that they find in the near peer coaches who deliver the curricula, who are in their age range, and they find that they can easily talk to them, because some young people would express that, you know, I live in a community where there is a counselor and there is an adult that's supposed to be available for me, but I find it hard to talk to that adult. But this is nice that I get a space to speak about mental health with somebody that's near my age range, that has more of an understanding of my needs. And then also when we're thinking about our mental health solution as well and looking into the research around it, evidence has really indicated that mental health awareness programs led by non-specialists in schools and communities are more cost-effective and essential, where especially in low-resource areas, you're showing a return of around $67.60 for every dollar invested, although the numbers are still being researched more and refined as to being more practical about the exact returns. We're seeing this idea of this value of these mental health awareness programs and specifically adolescent mental health promotion and prevention. Next slide, please. So our mental health solution and our strategy is really aligned to best practice, where we built our mental health package around the World Health Organization's intervention pyramid, where the global gold standard for effective mental health currently is in conversations where we were thinking, okay, at a basic psychosocial support level, what can we do? We then made sure that we are integrating mental health and mental health information into all of our skills curricula, and then thinking at the promotion of positive mental health aspect, having this mind skills program that is delivered in person to participants by near peer coaches, but also thinking about the communities they go back to, and not just having this in-person program and intervention, but also having what we call the Mind Skills Magazine, which is a supplementary tool that the young people can take back into their communities and start the right type of conversations with adults around them and with other people around lessons they're learning around mental health and around different other elements. And then we also thought about the psychological support angle, where we were thinking about mental health training for coaches to deliver things like group therapy to participants that are living with HIV. And then also thinking of the last layer of the pyramid, where if we were not able to assist a participant or are unable to provide that support, then having good referral systems to refer them to psychiatrists, psychologists, and other mental health professionals. So really thinking about the different layers of the pyramid and trying our best to ensure our programming really speaks to all of the layers as much as we can. Chris, any additions, questions you have for the group? Next slide, please. So what have we learned in this approach of trying to fill this huge void in care? On a data end, we've really seen this 96% reduction in clinically significant depression symptoms, and we're seeing promising results around reductions in stigmatizing beliefs, and really seeing more young people being able to identify local sources of support. But Chris did allude to one important thing about how we are a learning organization, and we continually are asking ourselves questions on what to learn. And another key lesson really that has come to us is this prioritization of coach well-being, the crucialness of caring for our carers, and ensuring that we have enough of a support package and enough of the support resources and mental health resources that our coaches need to continue to provide this valuable work, as I alluded to earlier, where young people keep speaking about how their coaches and their moments with their coaches is finally the space they get to breathe and say, this is what I've been thinking about mental health. Please help me rethink it better, because they feel like those are the people that they can actually talk to. But another key lesson really we've seen and we're having is this unprecedented demand for CRS mental health programs from stakeholders throughout the region who express this appreciation of our ability to speak to young people in languages that they can understand, with the fun aspect that they can appreciate, while ensuring that they learn enough to develop the skills that they need to be able to cope with life challenges. And one key example I always like to bring up is our phrasing in our Mind Skills magazine, where instead of asking young people to go home and write up a list of who their supporters are or who the people they talk to about mental health or challenges are, we actually write build your team, because we know the value of this idea of the team and the concept and passion around feeling like you're part of team and something greater than yourself. And really we're seeing the impact this is having on young people who are finding it acceptable and exciting to them to interact with our curricula, because it has the language and the fun that they need to learn without feeling like the whole conversation is just always going to be about mental health or HIV. So having that balance to make sure that they're continually interested in our programming. Chris, do you have any additions on that or any questions, follow-ups?
Sorry, I was trying to take myself off mute. Yeah, Charmaine, I know you've presented kind of the context for adolescent mental health work, our model and some of the things we've learned over the last 18 months. I don't know if it's a good time to, we'll have plenty of time at the end for questions, but if there's anyone that's got a pressing question on what Charmaine's covered so far, please unmute yourself and jump in. We'd love to hear from you. Otherwise, I'm all good from me, Charmaine.
Next slide, please. So where we are in the last 18 months, in the last 18 months from when our mental health strategy was launched, we've managed to launch our GRS signature adolescent mental health program, Mind Skills, and establish mental health programming in countries including, but not limited to, Kenya, Mozambique, South Africa, Zambia, and other countries on the slide. But we've also managed to increase the number of trained coaches and participant reach with our Grassroots Soccer mental health program, where so far those where our statistics are. But one of the greatest where are we's to think about is how we've secured strategic partnerships with ministries in Kenya, Mozambique, and Zimbabwe to not bring a program and give to governments to implement, but to co-develop and scale Mind Skills in schools and communities while starting from the get-go, working with government and working with government representatives and having that buy-in from the word go. Next slide, please. So highlighting our Kenya pilot case study on Mind Skills, which we started in April 2023, where we currently have about 32 coaches trained and over 1,000 adolescents reached to date. One of the key positive impact lessons from there is how early routine program data is strongly indicating that Mind Skills is making a positive impact on the mental health and well-being of both participants and coaches, where we even saw some unexpected learnings and outcomes where during visits with participants at intervention sites, they will talk about how they're doing better academically. And that wasn't something we were exploring initially or looking at, but that's something that came out from conversations with participants. And then again, from our lessons so far in the Kenya pilot case study is we have this strong, active Ministry of Health engagement at every program stage, which even the coaches found to be shocking to see somebody from the ministry and somebody from the government coming to an event that starts at 7 a.m. and staying till 5 p.m. and not only just coming to the event, but wearing their tracksuits and comfortable clothing and participating in the Mind Skills activities. Some of the participants were struck to see government representatives saying, like, I went through a mental health challenge 6 months ago, and this is how I dealt with it, and this is how I talk with my children about mental health. So really seeing a lot of government engagement and buy-in that is both exciting not only to us, but to participants and the coaches, because that's something that they hadn't been seeing in their countries. And we're also really looking and evaluating our pilot case study where we are including externally validated mental health measurement tools, including the World Health Organization 5, the PHQ-9, the Mental Health Literacy Scale, and the SDQ. So really making sure that we're also working on our evaluation to build our evidence base. In terms of our future planning and thinking about our Kenya pilot case study, one key thing I want to note for everybody on the call is if you could please note on your calendars for next year that we'll be having our Mind Skills dissemination meeting in Kenya in March 2024, and would really love to have representatives from external organizations, prospective donors, and different organizations just interested in all of the lessons that we've been getting so far from our Kenya pilot case study. Chris, is there anything you want to add?
Sorry, I'm having a hard time unmuting myself. I think maybe between these slides, Charmaine, it'd be great to hear from the group. We're really looking for examples of of government engagements at a local or national level that you've had experience with? Just anything that's working really well, if there are best practices, whether that's the Ministry of Education or Health. So we're kind of looking out there to see, are there examples of governments and civil society coming together and kind of doing this right? I don't want to put anyone on the spot, but yeah, if you have anything that comes to mind, we'd love to hear from you. If you can point us towards examples of interventions or partnerships, that'd be really helpful.
So, you know, it's interesting. We should have probably made sure our Africa colleagues were on this call, or more of them, because they could probably speak to the Africa side. I know that in the case of El Salvador, there's been work between USAID and Ministry of Education, Ministry of Health, and a couple of NGOs, both Glasswing as well as Funades, in terms of doing some of this work. I'm not that aware of where it's happening exactly on the continent. But that's what little I could offer there. So I do know that in other regions also, I mean, for example, Palau has a very high rate. Guyana has a very high rate of adolescent mental health issues. Both of them have, you know, substantial efforts being done by ministries of education and health on this issue. So.
Excellent. Thanks, Mike. Yeah, we're in touch with Glasswing. So yeah, that's a good connection. We should follow up with Selena there.
Yeah.
Yeah, I don't know, Marcy, if you have anything that jumps out. I know UNICEF has a really broad view of this. I don't know if there's any places, partnerships, governments that you look to that's kind of doing.
Yeah, I mean, in particular, I was thinking with my kind of mental health and innovation hat on, within this particular region for UNICEF, we had been working really closely and, you know, fairly successfully with Kenya, Uganda, and Tanzania ministries of health. That was predominantly around supporting the development and kind of long-term sustainability of a mental health chatbot for adolescents. And each country had co-creation, co-design workshops over a number of weeks. And Charmaine, you know, I loved you sharing there, you know, kind of like the colleagues that they came and they really engaged and stuff. And I have to say, we really noticed that in those 3 countries, that the ministry colleagues joined and were very active and vocal in the sessions in terms of sharing what they thought were the mental health needs, particularly related to designing a kind of, you know, SMS kind of mental health chatbot, something very rudimentary, nothing really fancy. Please don't misunderstand me. You know, we're talking about just how would you know, link to a child line, like child helpline, basically, in those 3 countries, if someone needed telephone counselling, versus could you send really positive, you know, more mental health promotion messaging via kind of like a mental health chatbot. So that's what kind of initially came to my mind, but I'm happy to take it back to, we have a fantastic MHPSS regional advisor in Eastern South Africa, which would cover some of these, and I can share more from them as well. But yeah, great question though, and important to know. Thanks.
Yeah, that's brilliant. We'll definitely follow up. Yeah, I think Charmaine will touch on some of our plans with digital technology. So yeah, great to hear that.
Yeah, Chris, I was just going to suggest that you mentioned the growing work with Strong Minds. Obviously, they've got in your areas of influence. They obviously have strong partnerships with government, and you might want to talk about that.
Yeah, John, that's excellent. Yeah, I know that they're active in Zambia and Kenya, and also some of the other countries that Marcia mentioned. So yeah, we've had a.
Well, Chris, just one thing on that, John, was I was really excited, actually. I got to meet last week in New York City with Helen Verdelli, or Lena Verdelli, who's a psychiatrist at Columbia. And she and her partner are sort of the IPT founders. And so they're the ones that are sort of, they, got IPT sort of launched and are working, across the world, pushing out IPT. They're now working on an IPT3, looking at a sort of a shorter, instead of, 9 or 10 sessions, can they do a 3-session? For anyone who doesn't, I'm sure most people know, but interpersonal group therapy, just an approach. And what Grassroot Soccer did was we've used IPT, but we've used HIV positive coaches delivering this to HIV positive participants, and really screening all of the HIV positive adolescents that we work with for depression, anxiety. So anyway, enough on that. Back to you, Chris.
Oh, that was perfect, TC. Thanks. Yeah, great context. Cool. I think, unless there are other comments, questions, back to you, Charmaine.
Thank you for all those comments. Took note of a lot of them. We'll ask many follow-up questions. But where we're going, really, having seen the impact and value of working with government, is instead of applying for grants with ministries at arm's length, we're now more focused on working with governments from the get-go and co-developing programs with GRS to ensure buy-in of our model and a quicker path to national adoption. But what we've also learned from engaging governments early is that they also have questions, a lot of questions around thinking around what an adolescent-specific mental health strategy looks like, and what thinking around specific frameworks around adolescent mental health promotion and prevention looks like, as most governments were temporarily still thinking about mental health as just a mental health program or general mental health strategy that just has all age groups and populations covered in one. And now with more conversations with us, they're really interested, as we learn from them, also them learning from us, how to really think about at that population level, adolescent mental health promotion and prevention as a specific area to explore and look at. Next slide, please. So currently, we have a lot of active collaboration and investment opportunities with government, where in Mozambique, we already have buy-in from the Ministry of Health to pilot and scale Mind Skills. We already have a prospective local implementing partner, and really we're currently working on identifying funding sources to get this going and get this to an implementation stage. So if anyone knows somebody who may be interested or would like to speak to us further about this current project, please do reach out or link us with somebody you'd have thought of. And also in Kenya as well, we have been thinking around looking at delivery of mental health programming through a teacher-led delivery of Mind Skills in partnerships with the Ministry of Education. Again, we're at the stage where we have the local partner to implement and we have the buy-in. It's now just a matter of really getting going and actually implementing the project. Next slide, please. In Malawi as well, we recently just completed a design program workshop, which was convened by the National Ministry of Health as well, where really a lot of the things that came out was thinking around creation of a menu of Mind Skills modules that partners and schools can use and integrate in other programs, and also really the Ministry of Health asking to help establish an adolescent mental health task force in country. And really this key theme around adolescent mental health promotion and prevention really coming out as well in Zimbabwe, where the Ministry of Health as well reached out to us to co-chair a working group on adolescent mental health as a specific focus population group, and really take a leadership role in shaping the national mental health strategy. And in Zambia as well, where GRS has worked with the Zambian government to launch a national mental health technical working group, both at a national and provincial level. Again, really still speaking to this idea that governments have a lot of questions about how to do this, and they feel like GRS is the organization that they can work with thinking around this different specialized area with a specific focus on adolescent mental health promotion and prevention in particular. Chris, did I leave anything out? Next slide, please. So we currently have multiple formal evaluations in progress, but I would like to first highlight our current digital mind skills pilot that we're currently working on in Nigeria, where we're trying to test out the effectiveness of a digital mind skills game at improving mental health knowledge and attitudes of youth not enrolled in our other programming, and also thinking about and seeing what the feasibility, acceptability, and appropriateness of that digital mind skills game is going to look like as a platform for youth to access basic mental health information. But we've already also had evaluations on proof of concept for our promotion of positive mental health programming. And we've also had our Mind Skills Magazine pilot assessment, where we're looking at the effectiveness of our Mind Skills Magazine promoting the mental well-being, where our findings showed statistically significant changes in self-concept and willingness to share mental health information. But we're also currently, as I stipulated to earlier, doing an assessment of our Mind Skills pilot in Kenya as well, where we're looking at really in the nitty-gritties of things. Does Mind Skills support the mental well-being of adolescents? And does it reduce symptoms of adolescents experiencing common mental health disorders? And really also asking ourselves in terms of looking at psychological support, if our coach-delivered group therapy can effectively reduce depression among youth living with HIV and experiencing depression. And this is something we're looking at in Zambia as well. So really looking at broad ranges of multiple evaluations of our in-person programming, which is the Mind Skills curricula delivered by the coaches, plus our supplementary Mind Skills magazine that participants take home, but also looking at evaluating digital innovations like our digital Mind Skills game that we're going to be launching and evaluating in Nigeria as well. Chris, any additions on that?
No additions, but I would say measurement is probably one of the areas where, as we've come into mental health, we've found the most divergent opinions. There's a lot of different views on how to measure mental health promotion or prevention, the effectiveness of indicated prevention or group therapy. So if that's an area of interest for anyone, any of our guests, and you have strong opinions or you've seen evaluations that you found to be really helpful, we'd love to hear any questions you have about the way we've thought about our research questions or the way we're trying to measure these. And if you have any guidance on outcome measures that you feel really strongly about, we'd love to hear from you.
Are you seeing any hands, Chris?
Can I just confirm that the dates on the bottom are when you expect to see the results from these pilots?
Yes.
Okay. That's great. Thank you.
Chris, I'm not seeing any hands. Next slide, please. So we've reached the end of the presentation, where I get to tell you, if you are interested in reading more in-depth information about everything I've been speaking on, please do use the QR code to access our 2022 Mental Health Impact Report, or use the QR code again to access our GRS mental health page that not only has information about our mental health programming, but also has some samples from Mind Skills and other key curricula and program materials that we have samples on the website for people to look at. Thank you.
Thanks, Charmaine. And Chris, we could probably just send everybody a copy of the report as well. So there's no QR. I know I probably wouldn't know how to do that, but anyway, but over to you, Chris.
Yeah, I'll just open the floor for any questions. Before I do that, I have one small favor for my Peace Corps collaborators. It was right before COVID or at the beginning of COVID. I'm trying to remember the timeline, but one of your colleagues, Amy, I think she's left now, Amy Wurzburg, maybe. We had sent over some of our mental health content to Peace Corps because she was really interested in having some volunteers test it out. And I think at some point, I know it was a crazy time because with volunteers getting pulled out and COVID. And so I'm not exactly sure what happened, but I know.
Katie, do you know her? Was she a field staff person?
No, she
volunteers at some point, games and activity, from what is now become, it was a precursor to kids, but
sorry, I just wanted to hear the
sorry,
rest. Oh, Chris, sorry you came in and out a little bit. But you were just asking about Amy, any follow-up to any of the work that Amy did. So Amy is no longer with Peace Corps. She's actually with USAID now. But we sort of put a pause on that. We were looking at Mind Power, actually, which you had mentioned as well. But now I think we're kind of back and like revisiting the mind skills, which is why all of our Peace Corps staff is here today on this call. So I think we're just sort of picking up maybe where Amy left off, but in terms of where she left off, I'm not exactly sure. But this is more related to a different region. So I think hopefully we can keep the conversation going here.
yeah, definitely. I'm really excited, and yeah, we're actually in conversations with Glasswing right now, who it sounds like maybe you also know, around a joint model for training frontline workers. So really excited, and they work all across Central and South America. So yeah, really excited. Yeah, again, just opening the floor. I know we've got only 5 minutes left before time, but any questions for Charmaine or Grassroot Soccer? We'd love to hear them. Otherwise, we might ask a couple of questions of you.
I have one question. Oh, sorry. Go ahead, Cynthia.
Okay, sorry. I'll just jump in. One, Charmaine, that was wonderful, super informative. Really appreciated your thoroughness, and what you're doing sounds fantastic. Chris, you mentioned a couple papers that you had that you are really formative. I would love to get my hands on those to any extent you're willing to share those, because that sounds awesome. I also am really, I'm opinionated about the measurement piece. I'm also really enthused about that. I guess one small comment I would just make is that I personally take a much more strength-based approach to even measurement. And I think it's really easy to go to a deficit approach. So, you give a kid an evaluation and you say, how depressed are you? How anxious are you? How horrible is your life? How much is alcohol a problem? All of the problems. And I think also having a strength-based approach is really, is its own kind of form of intervention, but also it's really important for us to be paying attention to that. So that'd be my own little piece on that, but really great content. You guys are doing amazing work. Excited.
Yeah, thanks so much.
Just to chip in on Cynthia's point there, we're just in the very early stages of working with Friendship Bench on something that they're calling, I think at this stage it's called the Hope Index or something like that, but it's essentially reviewing mental health issues as it were from a positive position. That's a piece of research that we're just about to start funding.
Right.
Yeah, we would love to. That aligns really well with our values, Cynthia and John, and I think it's one of the areas we've had big questions about, sort of outcome measures. So yeah, we would love to. The Hope Index sounds great, and yeah, we'd love to see that when it's ready.
Can I just ask
Someone
a
else?
practical question? And Cynthia, that's music to my ears. I love hearing that. Just practically, I'm just looking at the Mind Skills, the link that you, in the QR code, the Mind Skills curriculum as you've developed it as a 12-session curriculum with 4-module youth mental health promotion training for frontline workers. Could you just tell us a little bit about what is involved in becoming a trainer and how extensive that is? If it's similar to your other, curricula, or if it varies at all in terms of input.
Yeah, great question. It's really similar. If you've had any experience with skills training, the foundation is still the same. It's still, what are the skills you need to be able to create a really meaningful, positive relationship with a young person? And we've found those to be quite almost like universal. And as we come into mental health, we've kind of extended that, like with each of these areas. So for example, we might have something about creating a safe space or personal connections. We've kind of forced people to reflect on how that relates to mental well-being. So that's kind of the foundation. And then we have some specific things, it's about the Mind Skills curriculum, which is how we would approach making sure people are comfortable with this tool. And then we've got a couple of new components. So one is trying to help people take a little more agency and be proactive in their own well-being. So we have something on personal well-being, a module on personal well-being, and that's quite new. Just trying to help people have resources. People have really different approaches and strategies to taking care of themselves or asking for help, and making sure they know, what a psychologist is, a psychiatrist is, and what does the research say about coping strategies that we can take on ourselves. And that's a bit new. And then the other piece that we're still working through is what to do when you encounter a young person in distress. So we have a lot of, and I know Peace Corps and others have done great work in child protection and safeguarding. So we do have a lot of things in place for when a young person discloses something. But in the past, we haven't been very explicit about mental health in that approach. So what do you do if a young person is in acute distress? How do you respond to them? We're trying to figure out, what does a frontline worker need to know in that moment to respond? And so we've explored psychological first aid or mental health first aid. Glasswing takes a sort of trauma and education approach. So we're talking to them because that's a factor in a lot of communities where we work. So we're still working through that, but those are being able to deliver the program with fidelity, having these soft skills to be an effective facilitator of any youth program, being able to take care of your own well-being, and then this idea of responding to a young person in distress or with acute needs. And that includes things like making sure you can refer them, signposting, given the local context, which has lots of barriers and limitations. Is that helpful? Sorry, I was rambling a little bit.
Yeah, it is. At some point, as we're exploring what our vision is for kind of expanding, if we decide to partner to expand grassroots soccer in our region, kind of trying to figure out what resources we need to mobilize for the inputs, right, to make sure that we have staff and partners that are capable. So at some point, we'll probably need a little more detail, but unfortunately, I have to jump off this meeting. But thank you very much. I appreciate it. It was an excellent presentation. Charmaine, yeah, that was great. Thank you.
We'll definitely follow up. I know Ilana and her team are really excited to connect around this. So yeah, thanks, Katie. I know we're over time, 3 minutes over. I'm sorry about that. I think a couple of us can stay on for the next 5 minutes if anyone has burning questions they want to address, but otherwise we can officially wrap up.
Okay, thank you.
Yeah, maybe Tommy, Charmaine, anything from you before we close officially? And then yeah, we'll stay on for anyone that has a little more time.
Yeah, thanks, everyone. It's great.
Okay, yeah, thanks again. Thanks so much, Charmaine.
I did actually have a question. Again, this is Katie from Peace Corps.
Yeah.
So we're actually in the process of creating our what we're calling in the draft form as disclosure, referral, and linkage guidance for volunteers, is sort of like what is and is not the role of the volunteer in that area. But one of the things that we're having, at least as me being a person who is in the process of drafting this guidance, is what to advise volunteers to do when there are no resources to refer beneficiaries or participants to around them. And granted, our volunteers obviously are not mental health workers. A lot of them aren't trained, a lot of what we're going to be doing is telling them, look, there are basically limits to what a volunteer can do, what is and what is not their role when it comes to receiving or what they do with that information once it's been disclosed to them. But what in this curricula, how are you guys, I'm sure that's something that you've thought through, is what to do in situations, how to advise coaches about when there are no resources to refer people to. What's some of the strategy that you all are using for that, may I ask?
Yeah, I don't know. I'm happy to jump in, but Charmaine or Andy or Hannah, anything you want to say first? I also have my teenage daughter behind me. I'll have to jump off in a minute. But
Oh,
yeah,
I'm so sorry. Okay.
No. Yeah, Andy, Hannah, Charmaine, anything to respond to? It's a great question, Katie. Really good question.
What I've learned from how we approach it and how other organizations think about it is prioritizations of the key themes that you want your volunteers to have. So as long as they have the basics of understanding consent, privacy, confidentiality, and key immediate accessible social resources, and then ensuring that they also then have access to somebody else that they can then send that person to who has more training and more capabilities to advise, because especially with us, what we try to do is limit just how much our coaches have to do in addition on emotional support, etc., so that they aren't as burdened by the role. So ensuring that they have these point people that they then debrief with and speak to who have more of the skills and experience to do the referrals. So that's what other organizations think about and do, and that's what we do as well. But Chris, please feel free to add, and Andy.
Yeah, I was just gonna say, Katie, I know, especially I have been to some volunteer sites that are just in the middle of nowhere, and it's hard to kind of envision what a good referral looks like in that setting. And I guess I'll just say we take this positive approach in part because we're trying to drive mental talent. We think something like mind skills is going to be really that come up in the program. I would draw parallels to work in HIV or SRH, or there's, whenever you create a safe space for young people, these issues have been probably coming out for a long time, not using the term mental health, but sort of embedded in people's social experiences. And so my guess is you're already responding, and it's probably messy and looks really different in each community. But I guess, yeah, one thing is just our positive approach. The other is not like pathologizing young people, making sure you understand the experiences they're having in their social context. And then, yeah, I don't know, leaning on the resources that you do have, because, yeah, it's really, we're dealing with the same thing. There's just, no psychologist, psychiatrist. And I guess in that way, our programs take a positive approach in part because we're not sort of drilling down into young people's childhood trauma or past experiences. That's really not the approach, but in a safe space, it can come out. But it can come out, we found the same thing in our HIV work or gender work. A lot of stuff can come out if you create a safe space. And so, if there are social workers, that's often where we turn to deal, because often the mental health challenges will be embedded within other, relationships, social context. And so not trying to separate it out and necessarily deal with it from a medical perspective, because it's really hard to do that especially in a rural setting. Sorry, that was a bit all over the place, but I can send you some of our training materials. That's a really hard, it's a hard situation, and it's a great question.
Yeah, I mean, I think one of the things that's coming up for me is just for our generalist volunteers, and sorry for other people that are on the call that aren't Peace Corps from Peace Corps, but for our generalist volunteers, it's really hard to message to them, sort of, or it's not hard. We just need to do a better job, I think, of doing it, of what is their role and what is not their role. And so those types of questions do come up, is what do we do if there aren't any resources? This isn't something a volunteer is supposed to just like sit with the community member and, help them without extra support. So we're just trying to kind of figure out how best to support volunteers in these situations. And this would come about if they had mind skills or not. I mean, doing, HIV programming, youth and development, these are conversations, you're right, that are happening all the time. It's just giving them a little bit more structure to fall back on, I think, is what we're looking for. But yeah, that was helpful. Thank you.
I'm going to it's such an important question. I'm going to hand over to Charmaine and Andy. I have to jump off and drive my mom to the airport. So,
okay, yeah.
So great. Thanks so much. I think if I leave, it'll just hand over to another host, but thanks so much.
Thanks, Chris.
So I think that's probably it. I don't know, Katie, do you have any other questions on your end, or hopefully this has been helpful?
No, yeah, none at this point. Thank you all very much for inviting us. Yeah, look forward to working some more on this.
Yeah.
Awesome. Well, thank you guys, and thanks everybody for hopping on.
Yeah, thanks.
Thank you, everyone. Bye.
Yeah.